patient experiencing crushing chest pain, shortness of breath, and radiating pain down their left arm. These are classic signs of a heart attack where blood flow to the heart muscle is blocked. One of your key interventions is to reduce myocardial oxygen demand, meaning we need to decrease the workload on the heart. This is where beta blockers come into play. These medications work by slowing the heart rate and reducing its force of contraction, ultimately lowering the heart's demand for oxygen. By administering beta blockers as ordered, you can help limit the extent of damage to the heart muscle. And we're diving into a topic that's crucial for every nursing student and practicing nurse, the top 20 critical nursing interventions you absolutely must know. These aren't just skills, they're life-saving actions that can make the difference between a positive patient outcome and a negative one. We'll be covering a wide range of conditions and scenarios where your quick thinking and expertise will be vital. So grab your notebooks, your stethoscopes, and let's get ready to level up your nursing knowledge. First up, we're tackling septic shock, a life-threatening condition that requires immediate intervention. Imagine a patient presenting with plummeting blood pressure despite receiving fluid resuscitation. This is where your knowledge of vasopressors, like norepinephrine, comes in. These medications are your secret weapon to restore blood pressure and ensure vital organs receive adequate blood flow. By constricting blood vessels, vasopressors help stabilize your patient and buy you precious time to address the underlying infection. Remember, timing is everything in septic shock, and your ability to recognize the signs and initiate prompt treatment can truly mean the difference between life and death. Next, let's talk about heart failure, a chronic condition that requires careful management. Picture this: you're caring for a patient struggling to catch their breath with swollen legs and crackles in their lungs. These are telltale signs of fluid overload, a common complication of heart failure. Why does this happen? Well, when the heart weakens, it can't pump efficiently, causing fluid to back up in the lungs and body. Your role is to recognize these signs early and act swiftly. This means meticulous monitoring of fluid intake and output, administering diuretics as ordered to remove excess fluid, and providing supportive care to ease your patient's discomfort. Now, let's shift gears to diabetic ketoacidosis or DKA, a serious complication of diabetes. Imagine a patient arriving with excessive thirst, frequent urination, and fruity-smelling breath. These are red flags for DKA, a condition where the body produces high levels of blood acids called ketones. Treating DKA involves administering insulin to lower blood sugar, but this can have a significant impact on potassium levels. As insulin helps glucose enter cells, it also pulls potassium along with it, potentially leading to hypokalemia, low potassium. Your vigilance is key here. Monitor potassium levels closely and be prepared to administer potassium supplements as needed to prevent life-threatening complications like cardiac arrhythmias. Let's talk about acute kidney injury or AKI, a sudden decline in kidney function. Imagine a patient presenting with decreased urine output, swelling in the legs, and electrolyte imbalances. This could signal AKI, a condition that requires careful fluid and electrolyte management. The kidneys play a vital role in filtering waste products and regulating fluid balance, so when they are compromised, it's up to you to step in. This involves closely monitoring fluid intake and output, carefully administering medications to manage electrolytes like potassium and phosphorus, and providing meticulous skin care to prevent pressure ulcers in patients with fluid retention. Your expertise in recognizing subtle changes and initiating prompt treatment can significantly impact your patient's recovery. Next, we're addressing a true medical emergency tension pneumothorax. Imagine this: you're caring for a patient with chest trauma who suddenly develops severe shortness of breath, chest pain, and a deviated trachea. These are classic signs of tension pneumothorax, a life-threatening condition where air gets trapped in the pleural space, compressing the lung and heart. Time is of the essence here. Your rapid assessment and intervention can be life-saving. Recognize the signs, call for help immediately, and prepare for needle decompression. Now, let's dive into the world of liver cirrhosis, a chronic condition that can lead to a serious complication called hepatic encephalopathy. Imagine a patient with a history of cirrhosis exhibiting confusion, disorientation, and even changes in their sleep-wake cycle. These are signs of hepatic encephalopathy, a condition where the liver can no longer effectively remove toxins from the blood, leading to a buildup of ammonia in the brain. Your role is to recognize these neurological changes and act swiftly. This involves monitoring the patient's mental status closely, implementing a low-protein diet to reduce ammonia production, and administering medications like lactulose to help eliminate toxins from the body. Early detection and management of hepatic encephalopathy are crucial to prevent further neurological damage and improve your patient's quality of life. Let's talk about thyroid storm, a rare but life-threatening condition. Imagine a patient presenting with a rapid heartbeat, high fever, and altered mental status. These are red flags for thyroid storm, a severe form of hyperthyroidism that requires immediate attention. Thyroid storm occurs when the thyroid gland releases excessive amounts of thyroid hormone, overwhelming the body's systems. Your rapid assessment and intervention are crucial. This involves monitoring vital signs closely, administering medications to block thyroid hormone production and control symptoms, and providing supportive care to manage fever and dehydration. Next, we're focusing on myocardial infarction or heart attack, a condition that requires prompt and effective treatment. Imagine a patient experiencing crushing chest pain, shortness of breath, and radiating pain down their left arm. These are classic signs of a heart attack where blood flow to the heart muscle is blocked. One of your key interventions is to reduce myocardial oxygen demand, meaning we need to decrease the workload on the heart. This is where beta blockers come into play. These medications work by slowing the heart rate and reducing its force of contraction, ultimately lowering the heart's demand for oxygen. By administering beta blockers as ordered, you can help limit the extent of damage to the heart muscle and improve your patient's chances of a positive outcome. Let's talk about stroke, a time-sensitive condition that requires immediate action. Imagine a patient presenting with sudden weakness on one side of the body, facial drooping, and difficulty speaking. These are hallmark signs of a stroke, where blood flow to the brain is interrupted. Time is brain, and your rapid response is crucial. Immediately activate the stroke code, alerting the stroke team to ensure prompt assessment and intervention. Prepare the patient for a CT scan, which will help determine the type of stroke and guide treatment decisions. Now, let's revisit renal failure, but this time, we're focusing on a common and potentially dangerous electrolyte imbalance, hyperkalemia. Imagine a patient with renal failure experiencing muscle weakness, fatigue, and even dangerous cardiac arrhythmias. These are signs of hyperkalemia, a condition where potassium levels in the blood become dangerously high. Why is this a concern? Well, the kidneys play a vital role in removing excess potassium from the body. So when they're failing, potassium can build up to dangerous levels. Your role is to monitor potassium levels closely. Administer medications like insulin and glucose to shift potassium back into cells, and be prepared for emergency dialysis if necessary. Let's talk about atrial fibrillation, or AFib, a common heart rhythm disorder that can lead to serious complications. Imagine a patient with AFib experiencing palpitations, shortness of breath, and an irregular heartbeat. While AFib itself might not be life-threatening, it significantly increases the risk of stroke due to blood clots forming in the heart. One treatment option for AFib is cardioversion, a procedure that uses electrical shocks to restore a normal heart rhythm. However, before cardioversion, it's crucial to ensure the patient has been adequately anticoagulated. Why? Because cardioversion can dislodge any existing blood clots, potentially leading to a stroke. Your careful assessment of anticoagulation status and communication with the healthcare team are paramount to ensuring patient safety during this procedure. Next, we're addressing a critical situation: opioid overdose. Imagine encountering a patient who is unresponsive, with slow, shallow breathing and pinpoint pupils. These are telltale signs of an opioid overdose, a life-threatening condition that requires immediate action. Your first instinct might be to panic, but remember, you have a life-saving tool at your disposal: naloxone. Naloxone is an opioid antagonist that rapidly reverses the effects of opioids, restoring normal breathing. Administer naloxone as quickly as possible, either nasally or intramuscularly, and monitor the patient closely. Let's discuss pulmonary embolism, or PE, a serious condition that occurs when a blood clot travels to the lungs. Imagine a patient experiencing sudden shortness of breath, chest pain that worsens with deep breaths, and a rapid heart rate. These are red flags for a PE, a condition that requires prompt recognition and treatment. Your role is to assess the patient quickly, monitor their oxygen levels, and be prepared to administer supplemental oxygen as needed. Immediately notify the healthcare provider and anticipate diagnostic tests like a CT scan to confirm the diagnosis. Early recognition and treatment of PE are crucial to prevent life-threatening complications like heart failure and respiratory distress. Next, we're tackling hypovolemic shock, a life-threatening condition that occurs when there's a significant loss of blood volume. Imagine a patient presenting with rapid heart rate, low blood pressure, and altered mental status. These are signs of hypovolemic shock, which can result from trauma, surgery, or severe dehydration. The immediate priority in hypovolemic shock is to restore intravascular volume, meaning we need to get fluids into the bloodstream as quickly as possible. This involves establishing large-bore IV access and administering intravenous fluids, typically normal saline or lactated Ringer's solution. Your rapid assessment and initiation of fluid resuscitation can be life-saving in this critical situation. Let's talk about neutropenia, a condition that leaves patients highly susceptible to infections. Imagine caring for a patient undergoing chemotherapy who develops a fever. This seemingly simple symptom can be a sign of a serious infection in someone with neutropenia, a condition characterized by a low white blood cell count. Your role is to act swiftly and decisively. Immediately initiate protective isolation protocols to minimize the patient's exposure to potential pathogens. This includes wearing gloves, gowns, and masks when interacting with the patient and ensuring their room is kept clean and disinfected. Anticipate orders for blood cultures and the administration of broad-spectrum antibiotics to target potential infections. Now, let's revisit liver cirrhosis, but this time we're focusing on a common complication, ascites. Imagine a patient with cirrhosis experiencing abdominal swelling, discomfort, and even difficulty breathing. This fluid buildup in the abdomen, known as ascites, can significantly impact a patient's quality of life. One way to provide relief is through a procedure called paracentesis. During paracentesis, a needle is inserted into the abdomen to drain the excess fluid. Your role is to assist the physician during the procedure, monitor the patient's vital signs, and provide comfort and reassurance. Let's talk about bacterial meningitis, a serious infection of the membranes surrounding the brain and spinal cord. Imagine a patient presenting with a stiff neck, high fever, headache, and altered mental status. These are red flags for bacterial meningitis, a condition that requires immediate medical attention. Time is of the essence here. Your rapid assessment and prompt initiation of treatment can significantly impact the patient's outcome. Anticipate orders for a lumbar puncture to collect cerebrospinal fluid for analysis and blood cultures to identify the bacteria. Once bacterial meningitis is suspected, immediately administer broad-spectrum antibiotics as ordered. Let's revisit diabetic ketoacidosis or DKA and delve into the critical interventions for managing this serious condition. Imagine a patient with uncontrolled diabetes experiencing excessive thirst, frequent urination, and fruity-smelling breath. These are classic signs of DKA, a condition where the body starts breaking down fat for energy, producing ketones as a byproduct. Managing DKA involves two key interventions: administering insulin and intravenous fluids. Insulin is crucial to help cells absorb glucose from the bloodstream, lowering blood sugar levels. Intravenous fluids are essential to correct dehydration caused by excessive urination and to help flush out excess ketones. Now, let's talk about Wernicke's encephalopathy, a serious neurological condition often associated with chronic alcohol abuse. Imagine a patient with a history of alcoholism presenting with confusion, ataxia, or lack of muscle coordination and abnormal eye movements. These are classic signs of Wernicke's encephalopathy, a condition caused by thiamine or vitamin B1 deficiency. Your role is to recognize these neurological changes and act swiftly. Thiamine deficiency can lead to irreversible brain damage if left untreated. Administer thiamine intravenously or intramuscularly as ordered and monitor the patient's neurological status closely. Finally, let's address acute pancreatitis, a painful inflammation of the pancreas. Imagine a patient experiencing intense abdominal pain that radiates to the back, nausea, vomiting, and a distended abdomen. These are hallmark signs of acute pancreatitis, a condition that requires aggressive pain management. Opioids are often the first line of treatment for pain relief in acute pancreatitis. Don't hesitate to administer pain medication as ordered, ensuring the patient receives adequate pain control. Monitor the patient's response to pain medication and advocate for adjustments in dosage or medication choice if needed. And there you have it, future nurses. We've covered 20 critical nursing interventions that every nurse should know. Remember, these are just a glimpse into the many situations where your quick thinking and expertise will be tested. Nursing is a challenging but incredibly rewarding profession. Your ability to remain calm under pressure, critically assess your patients, and intervene swiftly can truly make a world of difference in their lives. Never stop learning, never stop growing, and never underestimate the impact you have on your patients' well-being. Don't forget to like this video if you found it helpful.